to hit the record button for us. Thank you so much. Hi, everyone. Welcome to our monthly All-Com webinar on Oregon's 1115 Medicaid waiver. Thank you so much for joining us today. We have a lot of great content today. My name is Jessica. I work for OHA, and I'm pretty much here just to say hello and then to hand it off, which is a nice job to have. So I'm just going to really quickly go over our agenda, and then you'll get to listen to other people who aren't me. So today we have some background information. We try to stick with just about the same background information every time so that we are all on the same page about what we mean when we talk about the 1115 waiver. We're going to talk about community capacity building funds and some updates there, as well as walk through some aspects of a tool that we are making called the member journey, which really walks through the different steps that members will experience as they are seeking health-related social needs services within the waiver. And we also have an evaluation update, and not on this agenda list, but we will be saving some time at the end to answer questions and to collect feedback, and you can help us figure out what we can share next month. With that said, I'm going to hand it off to Steph.
Thank you, Jessica. Hi, everyone. My name is Steph Jerem. I use she, her pronouns, and I am the 1115 Medicaid Waiver Policy Director. So I'm going to begin with just the waiver background. And if we go to the next slide, just to get everyone on the same page, we are here today to talk about the Oregon Health Plan. The Oregon Health Plan is what we call the Medicaid program in Oregon. It is the nation's public health insurance program for families, and it is a free health plan. It's available to individuals in the state who meet income requirements and some other criteria. And it's an ongoing rolling application process to be part of the Oregon Health Plan. If you go to the next slide, we are here to talk about a Medicaid waiver. And so what that means is we have a national program that is set by the federal government around how to deliver Medicaid in the states. It's a standard set of rules, and that is how each state delivers their Medicaid. However, if a state like Oregon says, hey, we want to try doing something differently, we can apply to the federal government and they can grant us a waiver, which basically says, here's some very specific things you normally have to deliver this way. And in Oregon, they're going to try delivering it in this way. So that is the waiver we're here to talk about. There are lots of waivers that we get in our state. We are here specifically to talk about the 1115 waiver, which we re-up every 5 years, and this was last approved at the end of 2022. If you go to the next slide, within our waiver, one of the things that we're really focusing on are health-related social needs. And so these are the social and economic needs that impacts an individual's ability to maintain health and well-being. Think about things that are outside of the doctor's office that contribute to someone being able to reach their health and well-being potential. And in our waiver, we specifically asked the federal government to be able to use Medicaid dollars to provide housing supports, nutrition supports, climate-related supports, and then outreach and engagement. And all of these are new to the Oregon Health Plan. These are new benefits. So we are going to talk about the health-related social needs work and kind of where we're at in that. I'm assuming many of you have already been part of these webinars to date, and so we've gone through lots of details on health-related social needs. What I'm going to talk about first is around our Community Capacity Building Fund updates. The CCBF program is a program to help our state get ready to deliver these new health-related social needs benefits. And so we wanted to just make sure to alert you all in case any of you are interested in applying or interested in learning more about it, that the application window is open. It opened on March 1st, and it will go through May 31st for the first year's funding, so for 2024 funding. The applications are due by May 31st, 2024. They are due to the CCO in your region. There will be another funding window open in 2025 if this is new or this is really overwhelming to you. There is a CCBF webpage that we can provide the link for that has much more information about this, as well as the contacts for your CCO in your region. Every CCO that is delivering these funds has more information and guidance on how to submit that application and budget. We did a lot of work on our teams in OHA to understand what the experiences have been of CBOs, community-based organizations, in historically working with OHA and applying to these types of opportunities, really aiming for a low burden application process. It's a standardized process throughout the state. And so at OHA, we have some information that is broadly applicable to everyone, but then the CCO in the region will be able to help you with any specific needs in the region. So please check out that website. And then we also have staff at OHA that can help if there are other questions that you have. And on our next slide, just to give you a sense of where we're at with our timeline and the funding. So we are in March. March has flown by. Can't believe it is the 20th of March already. CCOs have all signed their agreements. They've been reaching out to providers. We do know that in some regions, there have been some very active reach outs. There have been kickoff events, things like that. And in other regions, they may not have their staff available to do that quite yet. But we're in this space now where anyone who's interested in applying for these funds can reach out and begin filling out the applications and the budget requests. CCOs will begin reviewing those in a rolling basis, and then we'll be submitting that to OHA so that OHA has an opportunity to review the applications, ensure that there's a broad diversity of applications, that we're really trying to bring in organizations who have maybe not historically participated in Medicaid before. We also want to make sure that there are opportunities for us to be partnering with organizations that support specific populations that are underrepresented in some of our outreach and engagement. And then there will be 2 batches of funding dispersal at the end of the year. And we anticipate CCO providers will begin using the CCBF funds beginning in September. So I can pause there and just make sure if there are other questions that we can get to them. We do have other full webinars on CCBF in case folks are interested. Hopefully this isn't brand new information. We're really excited to see the investment moving forward. So, okay.
And I went ahead and put the website in the chat for everyone as well.
Great, thank you. Okay, so let's then move on. We're going to talk about the member journey. This, just to level set, this is a tool that we're working on that will be available that is really meant to help both members, OHP members, and providers and other organizations who will be supporting the members in understanding what it looks like for a member to actually access services. And so we are trying to help create this clarity across all sectors and really recognizing that not everyone is familiar with Medicaid. And so we want to make it super clear about how this will work. So if we go to the next slide, this is our high-level review, and then I'm going to go through each step. This is the OHP member experience, and this helps us understand how these Oregon Health Plan members will be able to request and access the health-related social needs services. This is already in process for Climate. Climate launched March 1st. Great news. We're really excited about what that looks like. We know that there have already been requests for different climate-related devices moving through. This will also be applicable to housing, which will launch in November, and nutrition. So step 1 will really be to be learning about options and getting started. Step 2 will be to complete the screening process. Step 3 will be getting the decision back from the health plan. That's usually a coordinated care organization, but that could also be our fee-for-service or open card program. Step 4 would be to get the actual service delivered. And then step 5 would be to use the services and get additional help when needed. So I will walk through each of these steps in more detail, and then we can talk about it. So the first one is to learn about all the options and to begin getting started. There's many ways that someone might choose to do this. The first is to work directly with the health plan, with the CCO or with the open card plan. There's something that we have called the HRSN request form. And this is a form that just has some basic information that helps describe what the need is and why someone may think that they qualify. We have an available form at this link right here if you want to check it out. Someone can do that individually. We are supporting self-referral. We recognize that in some cases that may be the best option for individuals. You can also work with a primary care provider, a community organization, someone else that you trust to help fill out that form and send the request form to the health plan. And so we anticipate this will be coming, these request forms will be coming from lots of different spaces. And that's what we want to see. We want to see that people are able to access and get started on this in whatever way that they're comfortable and with people that they are comfortable. So the second step is to complete the screening process. So after there's an HRSN request form, there's a little bit more detail that can be done related to a screening process that the health plan will help organize. It will provide some specific questions to find out which services they may qualify for. And in some cases, there may be a requirement to share some documents or information that can help with verifying eligibility. That's not always required, and we are really leaning on our CCOs to be able to look at data that already exists on a member to really help with validation so that there are very few requests of the member in providing some of the details. Step 3 would be to actually get the decision back from the health plan. So the way that we've written this in our contract is that people will then learn from their health plan whether they qualify within 14 days of completing the screening. We recognize that may seem like a long time, especially when we're talking about things like nutrition needs that are immediate or housing needs that are immediate. So we're certainly aiming to have that be less than 14. And those are things that we'll be monitoring and really understanding what this looks like as we go through this process. If people qualify, the health plan will refer them to an HRSN provider. And if they don't qualify, but they think they do, there are opportunities for an appeal, and they can get help from their service provider or from an OHP ombudsperson for that. This benefit is really interesting because it is a true benefit. And so there are appeal rights for someone who believes that they would be eligible, just like any other benefit in the Oregon Health Plan. People can also ask their health plan to check if they're eligible for the same or similar services through other programs. And so this is one of the things that is really important to understand, is that the waiver is just one tool of many that exist in the housing and nutrition and climate worlds. There are county programs, there are federal programs, there are grant programs, there are so many different ways, and we are trying to offer the waiver as one tool that is available, that is predictable across the state for some of these services. Step 4 would be to get the services. So the HRSN provider would contact people directly when their services or equipment are ready. And so you want to make sure that you have an updated address to either get the services or equipment wherever you're currently living. Once you qualify, we really want to get that out the door, but technically they do have up to 30 days to make sure that the services and equipment get to the individual. So Just want to make sure that everybody has the same understanding of the timelines. And the health plan is going to contact people by phone to make sure that the services were actually delivered or the equipment was delivered and that everything is working. And so when we think about this program overall, as a waiver, this is a demonstration project. We're really trying to learn what it looks like for the healthcare system to provide some of these services that are outside the healthcare system. So this step is really important for us to understand this, what we call a closed loop referral, that there has been a referral for these services, and then we really want to know what happened. Did it get to you? What did that look like? How much time? Is everything working? Is it what you needed? And so that will be part of that last step. And so then we go to the actual last step, step 5, would be using the services and then getting help when needed. So the health plan is still available if someone received equipment for the climate benefit, for example, to fix or replace that. They can also contact the health plan if they think that they may qualify for more services or different services, perhaps if they're in housing and they actually want some additional support with tenancy services and you want to be able to learn how to work with your landlord better. Those may be things you're eligible for, but you didn't initially apply for. And so we want to make sure that these options are constantly something that individuals recognize as new options within their plan. And then we also would love to see plans for ongoing care with a care team. So our goal in a lot of this is to help someone get to that higher level of health and well-being. And so ideally, these services are helping build up what that looks like. And a great way to do that is through a care plan. So the next step, or the next pieces, I'll just share some helpful tips. These would also be part of the member journey. People can update contact information. That's really important. Updating mailing address and phone number and email. That's how you would be contacted with approvals and with devices and all of that. We would also want to, or one of the things that can help is requesting the services directly from the health plan. It's totally okay to go through a community organization, and that can help too, but we know that directly from the health plan could help speed things up. And then, as I stated, that care plan. So helping to understand how they keep services once they qualify for them, finding out other services that you may qualify for. So those are some general ones. And then climate specifically, since this one's already launched, did just want to make sure that folks understood that people can ask health plan for help with installing those devices. And so that could be, you know, an air conditioner in a window, but it also may be other aspects of getting a device in the door. And then also they can know and communicate their right to install those devices where they live. And so we have some information here on tenant rights to help assisting with communicating with landlord when needed. So I'm going to go to the next slide and we'll pause there. I see lots of questions in the chat that I can start to answer as well, but these are some questions for all of you that we would love to hear from you, either in the chat, to our emails, or verbally. What questions do you have about how people can access these services? When you think about this, which steps or activities might be hard for people to do? Where can we be shaping this more or providing additional supports around this member journey? And then what kinds of information and resources can help people with navigating this? So many of you are coming from community-based organizations or counties or other organizations already serving members and individuals who will likely qualify. And so what is your experience here? What is your suggestions for OHA and the state as we help develop this? So Jessica, I don't know if I know you've probably been answering some of these. Do you want to read some of these out for me? Do you want me to go through and identify some to speak to?
I'm actually wondering to phone another friend. I see that Charissa has already been responding in chat really well. Charissa, I wonder if you can maybe walk us through some of the greatest hits of what you've been putting in the chat so it gets recorded here in the recording as well.
Yeah, absolutely. Some of the things where I think a link to the resource is really important. So I did answer a few of the questions where we could actually link to a resource for reference. So the first one was asking about the fee schedule, and it was specifically for nutrition. And I will say that we don't have the nutrition and housing fee schedules yet, but we do have the climate and outreach and engagement benefit services fee schedule. So I put the link in there. The other question that I think is really complex is eligibility. It tried to make it as simple as possible, but like Steph said, this is intended to fill a gap. There are other programs that provide similar services. So we're really trying to fill a gap under this waiver implemented program. So eligibility means that the person would need to be in an HRSN covered population. And I included a link where you can access the details of that. And then they would have to have, for climate specifically, a living situation where they can safely use one of the devices. And then a social risk factor, which means they don't have the device they're asking for. That's a pretty simple social risk factor on this one. And then also relating it back to the health outcome. Do they have a health condition that would be improved by having an air conditioner or a heater or a portable power supply, a refrigerator for medications that need to be climate controlled, for instance. So those are some examples there. And then again, the links for other resources are there as well. So those were the ones that I touched on. I don't know, did you want me to do more and pull out more, Jessica, or did you want to go through the ones that I didn't answer with Steph?
That was really helpful. Thank you, Charissa. I think I was able to look through these quickly and see that we have lots of answers here. In terms of working with nutrition services to develop this fee schedule, we just got that question. I would welcome you to reach out to our nutrition lead, Julie Reeder, and we can share her email address just to make sure that you're connected in with that work if you wanted to be. Our goal is to align fee schedules whenever possible with existing work. And so that's one space that I would just say, let's connect on that. And then this question about whether or not we go through flex funding or the HRSN benefit. So flex funding, or what's also known as HRS, which is health related services. I recognize that it's super confusing to hear HRS, HRSN, flex funding. How do we do this? Your CCO should really be the one who's helping identify whether or not someone is eligible, and if they're eligible through HRSN. If they're not eligible through HRSN, a CCO may provide the device or the service through HRS as well if there's a need. So ideally, you're just putting in the request, and then the CCO will be dealing on the back end with how that service is delivered. And yes, they would be, that's a good question about if it's an automatic referral. For climate, we know that there are some CCOs who are doing automatic referrals for the climate devices. I think that this is an area that we can certainly talk with CCOs to better understand what that is looking like for them.
Steph?
Yeah.
Hi, this is Jean from Yamhill CCO.
Yeah.
And I'll just give an example of our CCO. Because it's a benefit, if there's a referral for HRSN, we need to send the member a denial letter if they do not qualify and they're not eligible. And in that letter, we decided not to automatically send it to the Flex Fund. They will receive a denial. We have to keep track of those and show that we did our due diligence in the format that we're supposed to, we required. And then they will know that they can submit a referral for flex funds if they did not qualify for the HRSN. And, you know, with climate devices, it's not as complicated. Housing flex funds will not necessarily be able to pay for that 6 months or stuff like that. But there may be some assistance that can happen through flex funds when members don't qualify for the HRSN.
Okay, that's really helpful. Thank you, John. That is an example of how one CCO is handling this. And so I think we're all navigating what this will look like and how much eligibility is you know, the accuracy of an organization or an individual making their request and how many of them are getting access through HRSN versus denial. So those are some of the things that we'll be monitoring closely to try to improve what that looks like over time.
As an aside, I was poking around our website and the member journey is linked there now.
Great.
So I'm going to drop that into the chat as well. So those are those sort of more details around those steps that Steph just walked through.
Yeah. I think, and just to finish up on that question about why do a separate application, I think we will work through this. I recognize what you're saying, that this is like another burden. What is different and unique about this is that this is a benefit. And so there has to be a tracking of a denial that happens there. I think what you're saying is, well, could we just use the same form and then have it apply automatically to HRS? I think that's something that we could still talk to CCOs about what their process would be and how to reduce burden. So I appreciate what you are saying there, and we'll keep talking about that. So thank you. And I also want to acknowledge that there's a lot of really great stuff in chat and that we may not be going through it in as orderly as we could. So my apologies there. I do see a few questions that I think maybe all relate to the same central idea of like when we're talking climate devices, where does the form go? What are the devices? Who gets to make those decisions about what devices people can get and how? And I think the answer to that is the CCO, or in the case of open card members, Accentra, are that central force that can really help both members and providers and partners really navigate any part of that or any of these questions about the specifics. Having said that, I'll hand it to you, Steph. Okay, thanks. And I see that there's another question here about established sources for devices and preferred vendors and actual devices preferred. I do welcome Amelia or Josh, our climate experts, to pop on if you want to answer that.
Yeah, this is Amelia Reynolds. I use she, her pronouns, and I'm not on camera this morning. But to answer that question, there's, I think, essentially two answers. We've provided some essentially minimum specifications or guidance on the parameters that these devices should fall within. So to make sure that they reach a certain level of like space that they can cool. From that, our organizations that are actually delivering and ordering these devices do have the ability to choose what vendor or distribution source works best for them. The only thing that we've really set up is that we want to make sure that there's consistency across the state and the type and kind of quality of device that is ordered for each of these. We don't have strict, like we must use this specific device. One of the reasons for that is to allow for flexibility in times like the middle of summer, when access to air conditioners might be limited based on supply chain because there's a heat event that comes through our state. So allowing our organizations to choose where they get their devices from a few different models, hopefully will help us navigate around some of those or just be more flexible in those times where it's hard to find these types of things. But again, I think we have these minimum specifications to make sure that we're hitting devices that have a certain quality level.
Thanks so much, Amelia. Okay. Great questions. As always, please feel free to keep adding them to the chat. Please feel free to add your reflections in as well. And you can always reach out at some of the contacts that we have included. I am going to switch over to our next presenter at this point, and I'm still available for any final questions.
Thank you. Lisa Angus, are you up next?
I believe I am. Can you hear me?
You're a little quiet.
How's that? Any better?
Oh, much better.
Helps if the microphone is actually close to my face, it turns out.
All right, go ahead, and I'm happy to click through slides for you.
Great. If you could just jump into the next slide. Hi there, everyone. I'm Lisa Angus. I use she, her pronouns, and I'm with Providence Core, where there's Center for Outcomes Research and Education. And I just have a few quick slides for you all today that are related to waiver evaluation. So one of the standard requirements for an 1115 waiver, which is the kind we're talking about here that Steph introduced at the beginning of the hour, is that they have to have an evaluation. They are, in theory, a test of things that each state wants to try doing a little bit differently than the standard way at Medicaid. So as part of that, each state who has an 1115 waiver has to have an independent group evaluate how it goes and what the impacts are. The CMS, so the federal government, as part of the waiver approval, also needs to approve plans for evaluation or evaluation design. And the state has to contract with an external party to do the evaluation, is just to avoid some conflicts of interest. And so that's why I'm here and why CORE is here. OHA has contracted with CORE to develop evaluation plans or the evaluation design for this waiver. And then later we'll do a procurement process to pick one or more entities to implement the evaluation design. We are in the evaluation design phase. So next slide, please. So where we are now is that over the last couple months, end of last year, beginning of this one, we have been developing draft evaluation plans. These are guided in great part by a bunch of questions and evaluation interests that CMS includes in its approval. So there's a bunch of evaluation questions that CMS is really interested in having Oregon answer and take a look at. And then there are additional questions that have been added through consultation with a whole bunch of groups, with a variety of groups that from containing CCO representatives and Medicaid member representatives and other interested parties. And at this point, we have a whole bunch of draft evaluation designs for you to take a look at and react to if you're interested. So I've dropped in the meeting chat a single link if you'd like to just go to one place where you can see all these things. But on this slide, what it's showing is that just for ease of reading and digesting, because these things are long, we've broken down evaluation designs into 4 chunks, depending on what waiver policy component that they belong to. So there's one related to continuous eligibility and the temporary Medicaid expansion until the bridge plan is in place. There's one related to the policy and coverage changes related to young adults with special healthcare needs, one for the giant topic of health-related social needs, and then the last one around cost and sustainability. And then you can do, if you're interested in reviewing and reacting to any of these things, you can look at 2 levels of detail. So you can read the full draft of the evaluation design. These are pretty long documents and they're laid out in the format CMS requires. So they're a little bit researchy, for lack of a better word. We also made shorter summaries of the plans as they stand, the draft plans for evaluation design for each of those. Those are slide decks and they're available in English and Spanish. So you can review one or all of those if you have a whole lot of extra time on your hands. Next slide, please. I'm hoping that for most of the folks on this call, this isn't the first time you've heard about this. We've been trying to send email notifications out as widely as possible, including to past participants and registrants to these all come webinars, and other webinars that OHA hosts, and to interested parties that that we know from other venues, for instance, who have previously submitted comments on the waiver. So ideally, this isn't the first time you're hearing this message, but our current timeline is the final evaluation, the final drafts of the evaluation plans need to go to CMS at the end of April. So we are asking for feedback by next Monday. I realize now we're getting to the end of our feedback period, but we're asking for feedback by the end of next Monday on any of the questions that are outlined on this slide, any kind of feedback. So other questions that you think should be addressed in the evaluation, comments on methods or specific measures or outcomes that you're interested in, data sources that we should consider. Any of those suggestions are welcome, and you can submit them either by email on the top right hand of this slide, or there's a link where that is a little bit of a web form for submitting comments that's available in English and in Spanish, and those are the links on the top left-hand slide, or left-hand side, sorry, this slide. And then if you go one more next slide, just a visual of what I was just saying. So we're here in this little box right now in sort of the March period where we're sharing draft designs for feedback. We will make revisions based on feedback, and then CORE will deliver updated drafts of evaluation designs to OHA in late April, and OHA has to turn those around pretty quickly and get them off to CMS. And then there's a period where CMS reviews the evaluation designs, and they may have questions or other feedback that Oregon has to respond to. So it's not possible to say right this second when the evaluation will be 100%, evaluation plans will be 100% finalized, but ideally sort of towards the end of summer, early fall. So that's the overall timeline for this. I have one more slide, which is just contact information. So again, in the chat is a link to a single link to a page that has all those draft evaluation designs on it, as well as links to the forms that you can use to submit feedback. You can also send us a note, feedback, questions, or any other ideas to this OR 1115 waiver eval at providence.org email address at the top of this slide. There's some other contact information here, and a little bit more about CORE at the very bottom if you're interested in that. And that is all I have to share related to waiver evaluation. I'm happy to answer questions if folks have them. I suspect people have many, many questions about HRSN and fewer about evaluation.
Thank you so much, Lisa. It looks like most of the chat conversations are around HRSN specifically right now. Which I think is my cue to officially move us into the more general Q&A section. And I also want to let you all know there are some questions that we have not given answers yet, but I am seeing staff working hard on consulting with one another and seeking more clarity. So there are a few things that we haven't answered, and that's because they're really good questions that we want to make sure we answer right. And
I can answer, it looks like we have one at the end from Liz Garst. Hi, Liz, former colleague. Happy to see you still engaged in this work. So the question is around medical necessity component. We can certainly share more about what that looks like. So this is a requirement from CMS, from our federal partners on this work, to include a clinical need in HRSN eligibility. We have been really intentional in trying to keep that broad and keep that from being a diagnosis requirement. And so in some cases, it may be that the clinical need for a member there's a list that we can provide clarity on. And within that list, it may be that someone has said that they have a behavioral health condition. And what a CCO could do is that they could validate that at some point there has been, either the provider or the CCO could validate that this has been something that has been talked about at some point in care. So that's an example. There are lots of different situations that would qualify as a clinical need. And again, really trying to keep this broad. We've been trying to avoid medicalization of this benefit. And so there is a list. We can provide that list, or you can dig around and find it if you're interested in knowing more. That is in our services protocol document for sure, our HRSN services document. The other questions you had was around YSHN, which is young adults with special healthcare needs. This is one that we have some ongoing work around. You also mentioned the PMCA, that's the Pediatric Medical Complexity Algorithm. Young adults with special healthcare needs is a population that is an eligibility expansion group that is launching in January of next year. And so we haven't had a chance to really talk in detail about that group yet, because all of the focus on climate and housing and nutrition. But those will be coming in short order. We really want to start layering that in starting in April. And we'll speak more to that. But if you have other questions specifically on that, I'm happy to connect. And we have a whole team that's been deeply at work on this. We'll have a RAC, a Rules Advisory Committee, coming up on this work as well. And so lots of future engagement.
Thank you, Steph. And I did just get a note around there was a question about if people are required to have a physical address in order to access health-related social needs services. And the answer is that you are not required to have a physical address. If it is something that is a physical thing, we will need a place to coordinate pickup. And so there is a we have to know where and how to get that physical thing. And then when it comes to the climate devices, also we need to make sure we're connecting the dots on people having a location to use that physical thing, if it's something like an air conditioner or a fridge, things like that. And I bet Amelia could speak to it more eloquently than I just did. But I did want to circle back to a really good question that we had to staff quietly on the back end.
This is Amelia. You got it, Jessica. So I think the thing is, like, we need to actually, pass off or hand off this device. So if the individual has a relationship with an organization that's maybe helping them access these services, that organization can be the receiver of the device, and that's a location to do pickup. Like, I think that's something that will be worked out with the actual organization that's ordering and sending this device. But that's a great question. And then I appreciate the addition of, like, folks for these climate devices do need to have a physical space to plug these devices in, as they are electricity dependent. So that's kind of the second factor. But yeah, I know that some folks might have a physical location for them that is not as simple and straightforward as a mailing address. So there's definitely some room and flexibility to work with that, but you have to send a physical device somewhere and then coordinate the handoff.
Thank you. And I immediately answered it in chat because I feel pretty strongly about this question, but I should say it out loud as well. When we are talking about, like, OHP members who could be potentially eligible for health-related social needs services, that is inclusive of people who have OHP via Healthier Oregon. Absolutely. I see a really great question about health-related social needs, specifically reaching children and their families. And I'm not sure I have a ready answer, but I just want to say that out loud. It's a really excellent question. And something I think that we will definitely be logging. So thank you. And I see a question about if veterans covered by VA but are not on OHP, are they eligible? I think the answer is they are not. Someone must be an OHP member.
That's correct.
You all asked so many great questions that I'm struggling to find them all and to confirm if we have answered them or not. I did see, I think way back, a question about where to send the forms or not being sure about where to send that form. And I did see, I'm actually gonna, well, pardon me one second. I pulled up the form itself and there is a page within the form that has, pardon me as I attempt to go a scotch rogue. I did see that there is a request form active right now for climate related devices, and that on page 2, there's a section that talks about where to send the completed form. And it is a little less prescriptive because depending on who is requesting and if they're on ACCO or they are on OpenCard, there are different places to send, but there are links here to contact CCOs directly. And then for OpenCard members, there is an HRSN phone number, there's an email address, and there is a fax. So I think I wanted to make sure I didn't miss that one because it was asked way at the beginning.
Also, this is Jean. I just want to give another example. You can go on the CCO's website. They will have their own request form based on OHA's requirements. And so you don't have to fill out, 2 forms. Yes, we will take that form, but the CCOs should have the forms on their website and a way to submit it directly to the CCO. That's another option also.
Thank you. And I also see a question about seeking to help people get onto OHP if they aren't yet. And I'll never pass up a chance to shout out the Community Partner Outreach Program. We do have an excellent network of community assisters who can help people. And we have a team at the state that supports this network. And so I'm not very good at multitasking, but I'm gonna pop up a website. Oh, no, I think Tanya already got to it. Thank you so much, Tanya. Oh, yeah, all right. So there are a few different websites to help point towards resources. There's many ways to sign up for OHP. There's an online portal. There's a great group of people who can personally walk applicants through the process and help them navigate that. Walk into any ODHS office. There is a phone number, 1-800-699-9075, and those are all good options for people who want to get on OHP or to make sure they are on OHP. And I bet some of those people who are those excellent assisters and helpers are here on this call too.
And Jessica, there was one more question on that note before you sign off. It does not matter if OHP is secondary as well. As long as they are an OHP member, they can submit their request. So I just wanted to answer that one quickly.
Thank you so much. And I think for those of you who are more systems focused, it's OHP plus level of membership. So it has to be full OHP coverage. There are a few examples of related coverages that might not qualify. And suddenly we are well beyond time. I'm so sorry, everyone. Got carried away there. We are continuing to support these monthly. So you are in the English session for our All Come monthly webinar. We also have Spanish sessions in the afternoon on the same day. So here are the next 2 dates for that. There's a whole bunch of great resources. They're changing every day. I was looking just now and there were new links that weren't there, I swear, yesterday or last time I looked. So there's all of this. It will be accessible. And these are clickable links once you all have this slide deck. And we really appreciate you. I'm sorry to rush through this, but I also want to honor your time, and it is after 11. Thank you so much, everyone. Thank you, Steph. Thank you, Teresa and Amelia, for the really great information, and our friends at CORE. Thank you, Lisa. I hope you all have a great day.